This month, we're talking about a common autoimmune skin disease known as alopecia. It can cause hair loss and affects nearly 7 million people in the U.S. Joining us to explain the different types of alopecia is Dr. Leola, a hair restoration expert. Good morning. Thanks for coming in.
Good morning. Thank you for having me.
So you're known as the hair loss detective?
Yes.
Where did that come from? What's inspired you to educate other people about alopecia?
Well, thank you. So the hair loss detective is basically just like a detective. We solve the mystery of hair loss one strand at a time. And hair loss is almost investigative because there is something that's the root cause. So by asking questions, just like a traditional detective would do, we'll be able to determine some of the root causes of what's causing your hair loss.
Because it's not always alopecia, but people tend to just be more familiar with what alopecia is, right?
Yes. Well, alopecia is basically a medical term for hair loss, but there are several types. And post-COVID, there are just different types of things that's going on that cause people to have thinning hair, hair loss, scalp problems. So it's not just alopecia. Often it's scalp problems and things associated with just your hair isn't the way it should be or it used to be.
Very good. Okay, and so what would cause alopecia? What would cause somebody to have that?
Well, there are several types. So most commonly I see in my clinic is androgenetic alopecia, which is hormonal or hereditary. So if your dad or your grandmother or your mother had it, it's a possibility that you may. Doesn't mean you'll absolutely have it, but you have the propensity to have it more. Then we have something we see quite often called CCCA, which is a scarring type of alopecia. So if you're having any type of sensitivity, we see alopecia areata, which is autoimmune disorder, where your follicles start attacking itself. And more importantly, we see androgenetic. So we have androgenetic, CCCA, and alopecia areata.
And so, okay, let's say somebody does know that it runs in their family and they're familiar with a relative who had it. What would be some early signs that they should look for to know that they might be developing it?
Thinning part. Hair just
like right down the middle?
Right down the middle. If that part isn't as close as it used to be, that's a telltale sign. Okay. Hair falling out, hair on the pillow, hair in the shower. Or the photo comes back and it's like, wait a minute. So things like that. There are various reasons, but if in doubt, it's time to check it out.
Yeah, and so what could be done about it? I mean, I know people will start to panic if they realize, I think my hair is thinning, but is there something that can be done to help them?
It's many things that can be done. I mean, and the first course of action is taking the first step. Don't just try to go to YouTube University. Seek your professional of a trichologist or a dermatologist to try to determine what's going on. Let us scope you and see what's going on, because hair loss is a bully. And if you leave a bully untamed, it'll take over the scalp playground. So you have to deal with it heads on, but there are non-medical things you could do. Vitamins, supplements, rest, less stress. Stop stressing about everything.
So maybe it would depend on where the hair loss is coming from to determine the treatment moving forward?
Best, absolutely, by far, you know, because depending on what the antagonist is how you want to deal with it. So it's not a one shot fits all. And I'm about to publish a book called Beyond Shampoo. It's not just shampoo. That's not the cure-all for it all.
There's more to it.
By far.
And I think there's newer stuff on the market, because I mean, a couple decades ago, if somebody was losing their hair, that might just be a sad story for them. But now there are newer things that actually work, right?
Oh yeah, in fact, there's some extraordinary technology. We have something in our office with stem cell therapy, where in the same day we can give you a cosmetic look with the stem cells that continues to grow your hair over time, just sort of like the eyebrows before the hair. So you can walk in thinning and win out grinning and winning. But there are many things. You just have to inquire. So much technology, and this is non-invasive. It doesn't have to be surgery or anything like that. And a lot of our hair is just not as thick as it used to be.
People are pretty skeptical about the stem cell therapy. So if they weren't comfortable trying something like that, do you do like the platelet-rich plasma or other types of injections?
Yes, well, PRP still is a stem cell. It's just your own stem cells. So there are various stem cells. You can use PRP. You can use stem cells from the umbilical cords of newborn babies. So you talk with your provider what you're comfortable with, but there are studies to show how effective it is, and I see it every day.
What are some of your favorite treatments? treatments?
My favorite treatments is scalp recalibration, scalp detoxing, exfoliating, removing the dead skin, just like you would your face, you know? We have to get it off. And changing up your shampoo. Don't use the shampoo, because when you change it up, then your scalp is like excited, something new, and it responds. So everything goes
up.
It wakes up like a new day. Hey, something to do. Microcirculation. You got to get that circulation going. And people will look at you like, girl, you look good. It's the hair. It's always the hair.
Yeah, and so some people would choose protective hairstyles like braids and things like that. And then I've also read that those kind of tight hairstyles might also be damaging the hair. So what's the truth?
Both. There's something called traction alopecia. It's most commonly known as traction. I've coined it trauma. Anytime your hair experiences trauma from that type of tight braiding, you're going to experience some damage. So you don't have, and the longer you wait, the more prolonged it is. So the more damaging it is. Braids can be good, but you have to know what you're doing. You have to treat the hair. There's a lot of hair that contains bacteria, causes further problems. So if you're itching or scalp slapping, you need to look into that.
So what if we do want to do something protective for our hair? What would be a protective hairstyle that you would recommend?
Maintaining your hair, sleeping in satin bonnets, make sure it's something your husband likes, but you know, sleeping. Not rubbing your hair up against too much cotton, detangling. I have a patient the other day, she was losing a lot of hair because as soon as she gets out the shower, she's brushing it and your hair's in a different
yanking on it, yeah.
Yeah, your hair's in a different state, so be very careful when your hair is wet, the way you deal with it. Your hair has a personality.
Yeah.
Yeah, you gotta know the personality of your hair.
Yeah, I never thought of that because what about those wet brushes where the bristles kind of move when you brush through?
Just be careful. There's a lot of good marketing. These guys are marketing genius.
Yeah.
You have to know your hair, right? And I often tell people your hair is not a magician. It can't be in two places at one time. It can't be in the brushing on your head. You have to decide. So just be careful how you're detangling your tresses. Treat them well, and they'll stay with you a long time.
Well, Dr. Leola, what did you want to tell people the most about coming on here? What do you want them to take away about alopecia awareness?
I want them to take away that alopecia is real. It's nothing you have to be ashamed of. Don't hide it. You have to come out and do something about it because it'll only exacerbate if you do not. There are many things available. Seek out a trichologist. A lot of people don't know what a trichologist does, but we're hair loss specialists. Often they may go to a dermatologist, which is mostly a skin specialist. They're medical, we're clinical. We have one child that's the scalp, and we're able to get to the root cause, so that's why we probably have a little better success in getting to the root cause and helping you deal with the hair loss, but don't suffer in silence.
Where are you located?
Northwest Freeway in Tidwell and Hollister, and we're looking at opening a location in Katy area. So,
okay,
centrally located.
You want people to come see you, ask about?
Oh, they need to come. We have a whole vibe in our clinic. We have a med spa type clinic. We treat people. We have like at least 7 multi-therapeutic solutions that we use. We don't guess. We test. We look at them on the cellular level. What I'm really proud about, we're able to look at and ascertain to about a 95% method of what's causing your hair loss. So we need to know what the culprit is, because why would we keep giving it a Band-Aid when we can clearly see why you're having this hair loss?
How are you testing? Is it a blood test?
Hair.
You're testing the actual hair?
I send the hair. Your hair will tell you everything you need to know for the last 10 years. Your hair holds memory. It's not like blood that moves fluidly. In some cases, we do compare it to the blood, but the hair is the cellular truth. It'll tell what's going on, what's causing this, what your food sensitivities were. And there's a gut-brain connection. So often we have problems in our gut. We have anxiety. I see a lot of anxiety.
Yeah.
So they're very connected. So we deal with a myriad of what's going on.
The gut holds a key to many, many things.
It's the second brain. Yeah, it is. And it's underestimated. You know, we have gut issues. And so often we're so busy with life, we just forget. It's like, I can't just keep being bloated for no reason. Oh, but there is some good news to hair loss. You want to know what it is?
Yeah.
The good news to hair loss is a tattletale. If you have hair loss, it's telling you that, Mom, something's wrong in my body. Hello, knock, knock. And then us pursuing why you're having hair loss, we're able to uncover all types of health situations. Kidney, liver, gut. It's just totally surprising.
Well, Dr. Leola, that was very informative. We appreciate your time this morning.